will the Welsh Government provide an update on plans to ensure social care workers receive the real living wage?
We've asked the Social Care Fair Work Forum for its advice in delivering our commitment to introduce the real living wage to social care workers. I received the forum's advice last week and will consider this advice carefully before I provide a further update.
Thank you, Deputy Minister, for your answer. Last month, RCT Council Cabinet announced they'd work with independent social care providers to help them access funding under the Welsh Government's Social Care Recovery Fund. This is so that they can provide the real living wage for the social care staff that they employ. Whilst looking forward to further announcements regarding Welsh Government's plans to ensure all social care staff receive the real living wage, what discussions are you having with partners in local government in the meantime to encourage them to take similar proactive steps and ensure that our invaluable social care staff receive the fair wages they deserve?
Thank you very much for that question, and I'd like to congratulate RCT on the steps they're taking and the other local authorities who are taking similar steps, but progress across Wales is patchy, which is why we are taking a national line. We are working very closely with local government about delivering the real living wage. The Minister for Health and Social Services and I meet every week in the Care Action Committee with representatives from the Welsh Local Government Association, as well as representatives from Health and others. The leader of the WLGA, Andrew Morgan, and the Social Services lead, Hugh David, are both there, as well as WLGA officials. And in addition, the WLGA and the ADSS, Association of Directors of Social Services, are members of the Social Care Fair Work Forum, which has just provided this advice. So I can assure you that we are closely bound in with all the local authorities in Wales, and we are looking forward very much to the time when social care workers in Wales receive, at the very least, the real living wage, which is what they deserve.
Any delay in improving pay and conditions of staff will continue to have an impact on recruitment. This impact is being felt by our NHS and local health boards are rightly taking notice and taking action. Some health boards are now looking to directly employ care staff. However, rather than helping to address the problem, the care sector believe this is simply leading to the poaching of staff by the NHS, which offers better pay and conditions. Deputy Minister, we are supposed to be integrating health and care, not setting them up to compete with one another. How will your government ensure that these pilot schemes by local health boards are not creating shortages in the care sector? Thank you.
Well, this is obviously a danger that can happen. As you know, we've set up the Fair Work Forum, the Social Care Fair Work Forum, which has recently produced their report about how we will deliver the real living wage, and that is being considered by officials at the moment, so I hope we'll be able to announce something on that soon. So that is imminent, but of course it's just not the pay, it's the terms and the conditions and all the other things that, as you say, the NHS staff have much improved conditions compared to social care staff. So I think we have to make every effort to boost the social care profession. At least through all this pandemic, I think people are now aware of what social care is, and I think there is an appreciation of what social care workers do, and we are determined to uphold the standing of the profession. And one of the things we have done is registration of the profession. All domiciliary care workers are now registered, which increases the standing of the profession. And we are moving on to residential care workers now to do the same there. I think that what we've got to do is increase the standing of the profession, show that we value the work of the social care workers. We did make 2 payments to them during the period of the pandemic, and I know that they were very grateful in terms of the recognition of what they contribute. So I think that's what we've got to do.
Thank you again, Deputy.
Minister, what measures will the Welsh Government take to improve the speed of hospital discharge for patients in the Cwm Taf Morgannwg University Health Board area?
The Welsh Government has provided significant additional funding to support improved patient flow and discharge processes, including in the Cwm Taf Morgannwg region. We're also working to address current capacity and workforce issues in social care, to support quicker discharges, including through the real living wage for care workers?
Minister, thank you for the answer. And the question I'm asking about my own health board area, you could equally replicate across Wales, where there isn't one answer, but it is the question of getting the right resources across those range of factors which will help speed discharge. And of course, there's an importance of this for patients within hospital and freeing up important beds, but also for getting people home so that they can be supported in independent living at the place that they want to be as rapidly as possible as well. Could you just give me the assurance that you'll continue to work with Rhondda Cynon Taff and Bridgend local authorities as well as the Health Board to make sure that the resources are in the right place at the right time, and that also the support is there for voluntary sector such as care and repair and others, and the home support teams that are doing such great interdisciplinary work?
I thank Hugh Ranker-Davies for that very important question. I think we all know what a difficult time this is for health and social care, and how damaging it is for people to stay in hospital longer than is necessary. So we are continuing to work very closely with health and social care partners to support effective discharge processes, and we have provided significant additional funding. The Integrated Care Fund and the Transformation Fund have assisted regional partnership boards with developing new integrated ways of working. In Cwm Taff and Morgannwg, for example, the Stay Well at Home project has continued to develop, which prevents unnecessary hospital admissions and ensures that there's timely discharge for those people who require admission. The ICF also funds health and social care discharge coordinators in Cwm Taff Morgannwg, who also help timely discharges. And in addition, the member mentioned Care and Repair Cymru. We provided over £500,000 in 21-22 to Care and Repair Cymru to deliver the hospital to a healthier home service, and this facilitates safer and quicker discharges for vulnerable older patients. And within the Cwm Taff Morgannwg region, the service is delivered in the Princess of Wales, Royal Glamorgan and Prince Charles hospitals. So I agree with the member, it's absolutely essential we work closely with the local authorities and with the Health Board at this very difficult time for the services to provide maximum integration.
Thank you, Presiding Officer.